department here at Wayne UNC Healthcare. I've been here about 5 years, and it's such an honor to put these events on for you guys. My husband is a pastor, and I always tell him, I'm like, sometimes I don't feel like I make a difference compared to what he does, and he always reminds me every time I come home after an event, he's like, babe, there was 100 people there tonight that learned something that they didn't know, and if one of them lives one day longer, like, you really have made a difference. And so now whenever I put these events on, I do try to think like, wow, all these people are coming and they're going to do one thing differently tomorrow that they didn't do today, and it's going to affect your life forever. That's my hope. That's why I show up to work every day, to do things behind a computer that sometimes I feel like I'll never see a difference being made in your life. So thank you so much for being here. It really is an honor to have all of you guys here and to have physicians that support us. At this time, I want to do something a little different that we've never really done before. If you are a teammate here at Wayne UNC Healthcare, will you please stand? I just want to recognize you for helping us, because it does take a team to put all this together. Yes, thank you. I know we have several people from performance improvement. I've seen organizational learning, our rehab department, also our physicians, the Center for Nutrition and Diabetes Health is in there as well as the Mended Heart Support Group. Thank you to Food and Nutrition. I've been checking in with them today about those heart-shaped cookies. I know that they had to go get a heart-shaped cookie cutter, and apparently that's not very easy when it's not Valentine's Day. Also to Environmental Services, I don't think that they're here, but they move all of our tables for us every single time we have an event, put out all these chairs, and they do it and never really get any notice for it. So yeah, at this time, I would like to ask you guys if you have a cell phone to silence it. That's just a little gentle reminder. Also, restrooms are, if you go out these doors at the back, past the ice machines, and turn to the left, the restrooms are right back there. They're not in this room, but they're right around the corner. Sometimes y'all don't know where they are, so I wanted to remember to tell you that. The vendors are in this room right over here, our wall with 3 good things. They're right behind that. We have a table from Rehab Services, a table from the Mended Heart Support Group, the Stroke Support Group, as well as the Center for Nutrition and Diabetes Health, and I think there might be one more. Maybe that's it. Also, we're going to try something a little different tonight. You may wonder what those high-tech remote controls are in your seat. If you'll hold on to those for just a minute, I'm going to introduce one of my friends to you, and she's going to come up and we're going to do a little game of sorts, a little trivia. They're actually clickers, so we can poll the crowd and get your opinions on some things. May is Stroke Awareness Month, and so we're really excited that we could theme this event around Stroke Awareness Month. And I do want to give a shout out. Wayne UNC Healthcare has achieved Silver Plus status for our continued success with our stroke program. This achievement is given by the American Heart Association, and it brings national recognition to Wayne UNC Healthcare for improving patient care and outcomes for stroke patients. So that is really awesome, and we are really proud of them. Sarah, she's back there at the back. She works really closely with our stroke program. She's had a baby 1 week ago and came tonight because she wanted to be here, and I'm just amazed by her. So thank you for being here. We think you're wonderful. At this time, I want to introduce my friend Jennifer, who's filling in for Sarah tonight because we didn't want to put her in the hot seat. Jennifer is an RN. She works in performance improvement, and she's part of our stroke team. She's going to come up and tell you a little bit about those clickers and get us started. All right. You got to hold this one.
Okay, like Brittany said, May is National Stroke Awareness Month, and we really wanted to provide education for you guys in the month of May, so we were like, let's do a Live Well event and do some education about stroke. And when we found out the date was close to Mother's Day, we thought, well, this is a great opportunity to focus on the women's unique issues with stroke. So it's true that more women from men die from stroke, and it is the 3rd leading cause of death for women in North Carolina. So it's very important information that we want to get out. So our goal is to get this information to you, and even if it has a slight twist towards mom's health, we think it'll be useful for all of you guys out here too. The name of our event is Love Your Heart, Love Your Brain. Maintaining a healthy heart is so key for all of us. It's so important. And many of the things that you do to prevent heart disease are going to also help reduce your risk for stroke. So we wanted to bring you this information in tandem, and we have two great speakers for you guys tonight that are going to help with that. So before we get started, like Brittany said, we're going to do our little audience participation quiz. So if you'll pick up your clickers and turn them on. The red button. Am I supposed to move this down? Are you moving? Okay. So the first question is just, okay. The first question is just a little, we need a little information from you guys just to help with planning future programs. So have you ever attended a LiveWell event at Wayne UNC Healthcare? And wait just a minute. I'll tell you when to press, when to choose your choice. A, this is the first time. B, I've been once before. C, I'm part of the LiveWell fan club because I attend so often. Hang on 1 second, I will tell you when to go.
Okay. There you go.
Okay, make your choices. Make your choices. A, B, or C. Can you guys see? You want me to read it again? A, this is my first time. B, I've been once before. C, I'm part of the LiveWell fan club because I attend so often. We have a question.
Hold down the red button.
Hold down the red button to turn it on, and if you need help, we have some folks in the back that can raise your hand and we can.
Do you see something in here, in your little window? You see some words? Okay.
81 have answered.
Okay.
Okay. And so C is the majority of you guys answered C. So that's great. Thank you for coming again and again to these events for us. All right, the next question. What is the leading cause of death in females in the United States? A is cancer, B is diabetes, C is heart disease. And you can go ahead and answer now. A is cancer, B, diabetes, C, heart disease. This is the leading cause of death in females in the United States. All right. You guys are so smart. That is correct. The answer is C, heart disease. So you can see why we really want to bring you some information about that tonight. All right. Third question. Someone in the United States has a stroke every A, 4 minutes, B, 40 seconds, C, 2 minutes. Someone in the United States has a stroke every A, 4 minutes, B, 40 seconds, C, 2 minutes. Okay. We need that music from Jeopardy or... do, do, do. Okay. Okay. The answer is, that is correct. We can all go home. They know it all. Okay. B, 40 seconds. That's correct. So, it's an estimated 800,000 strokes per year. 1 in 5 women will experience a stroke in their lifetime. Okay. Fourth question. If you think you are having a heart attack or a stroke, what should you do first? A, call 911 or emergency response number because time matters. B, wait 30 minutes, and if it doesn't resolve, call your doctor. C, lay down and take a nap. All right.
Because they will call the office. Yeah, that's what I said, but they'll call the office.
Okay, everybody better get this one right. Very good, 100%. Way to go. Yay. But that's right. That's right. But actually, studies have shown that women tend to downplay their symptoms of stroke or heart attack, and that's normal, and they don't seek treatment as rapidly. And we're encouraging you all to come on into the hospital where we have providers that are trained to diagnose and treat your stroke or heart attack. So, very good. All right. Last question. What does FAST stand for? A, fear, acceptance, stress and time. B, follow-up, assessment, symptoms and temperature. C, face, arms, speech, time. All right.
Don't worry, mine's quick.
Okay, we've got the music going. That's right, it's C. Very good. Wayne County is very smart. So this is an acronym that is commonly used to teach people about the signs and symptoms of stroke. So face, the F is for face. If you have drooping face on one side, the arm is the A, or either leg, weakness in the arm or leg. Speech, slurred speech, or difficulty getting your words out like I'm having. And then the T stands for time. And so we use this to help teach people to remember. But the key thing to remember is if you had a sudden onset of these symptoms, so a sudden onset of facial drooping or arm weakness. And then the time is we really want you to get to the emergency room and call 911. So thank you guys. Great job. And the clickers, now we will collect them at the end of the program. They're not a door prize. So there are several people standing in the back, and if you'll just make sure that you either turn it in at the registration table or hand them to somebody with a badge on, then we will take care of those and hopefully use them at future programs. Okay. So, like I said, we have some great speakers tonight. It's my pleasure to introduce our first speaker. She is one of our neurosurgeons here at the hospital. She is from Vidant Neurology and Neurosurgery. I should have left my paper, cut up my paper. She's from Vidant Neurosurgery, and her practice is on Country Day Road. And so at this time, would you please welcome Victoria Samuels, Dr. Victoria Samuels.
I'll go over these. Can everyone hear me? Good. Happy Mother's Day. All right, let's talk for a minute about strokes. A stroke is interruption of the blood flow to the brain. That's the first and main thing that you need to know. There are two types of strokes. One is called ischemic, that's the lack of blood supply. The second is called hemorrhagic, that's where you get blood in the head, okay? It's still all vascular, it still causes damage to the area of the brain. The most common, can you hear me? Oh, the most common is the ischemic stroke. TIA, people have heard of this, transient ischemic attack, in a sense that is truly not a stroke. That occurs, can you turn that down so we're not, thank you. Transient ischemic attack is basically what a lot of people will call a mini stroke. That's not really a true word for it. What it means is you have some neurological deficit, problem with speech, weakness, but it completely resolves within 24 hours. If it doesn't resolve, that's not a TIA, that's a stroke. Okay? The negative thing about TIAs is that if you have one, you've got a 10% risk of stroke the next 30 days. That's huge. So even if you have weakness or numbness or any of these symptoms we'll talk about in a second, and it goes away in 5 or 10 minutes, that doesn't mean that you're safe, okay? What it means is that you've more than likely had a TIA. You need to be seen, evaluated, and treated so you don't have a true long-lasting stroke in that 30-day period. Here's the statistics. Now, I don't want to get into the deep part of the statistics, and part of the reason is it becomes frightening, and when it's frightening, we end up not taking care of it and hoping it will go away, and that's what we don't want. But let's go through the strokes a little bit, the statistics. About 800,000 people have a stroke each year in the United States. That's a huge number. Stroke will kill one person every 4 minutes in the United States. Now, has anyone heard of the stroke belt? Okay. That's a combination of 11 of basically the southeastern states minus Florida, but we know Florida's not southern anyway. And what it shows, and no one's exactly sure why, there's a lot of discussion, but our risk for having a stroke is literally double what it is in most other states. That's huge. That means we have to be twice as impressed and twice as concerned to do the right thing so we don't have a stroke. The other thing is African Americans have 2 times the risk of stroke as whites. Again, that's a huge, huge number. Stroke is, depending on who you read and depending on whether you're talking about males, females, whites, blacks, Hispanics, stroke is about the 3rd, occasionally to the 5th cause of death. Okay? The first is heart disease, 2nd is cancer, the 3rd is stroke. Okay. Signs and symptoms. They are usually either acute or stuttering. Now, again, we go back to what I was saying about with the TIAs. If you have weakness in the face, and I'm just giving that as an example, weakness in the face, and it goes away, you can't say, oh, whew, boy, I passed that bullet, okay? It could come on in the next time, or the next minute, or the next minute. So you have to realize what that is, and we'll talk about what to do about it in a minute. We've already talked about what fast means. It's not bad. We'll talk a little bit more about it. It's facial weakness, arm or leg weakness, speech difficulty, and time to call 911. But these are only part of the symptoms. The fact is, depending upon what part of the brain is affected will depend on what type of symptoms you will have. You can have acute visual loss if it affects the occipital lobe. You can have numbness on one side of your body or just one side of your face. You can have difficulty with comprehension. So you have no weakness, you just cannot figure out anything, what's going on. Even acute loss of balance can be signs of a stroke. What are our risk factors? Well, I've got two pages here. The first one is hypertension, smoking, high cholesterol, diabetes, and diet. We'll put all of those 2 together. Sedentary lifestyle and oral contraception. Okay? Then we'll go to the next page. The next page is family history, age, heart disease, and sickle cell disease. Can anybody tell me the difference why I've separated these 2? Okay. Last time I checked, and trust me, I've tried, you can't do anything about age, okay? You got it or you don't got it, okay? The same thing as family history. You can move away, you can divorce your parents, okay? But you still got that family history. So these are the things that we don't have control over. But what that means is we do have control over all of these. And the three most common cause, or risk factors I should say, for a stroke is hypertension, smoking, and hypercholesterol. The top three, okay? Any questions so far? Okay. Now the good news is we're getting a 2-for-1 here. A 2-for-1 sale, Mother's Day, right? All right, the 2-for-1 is, and we'll soon hear about the heart, is hypertension, cholesterol, and smoking are the three most common factors that also affect the heart, which is number 1. So if we can deal with these three things, these three factors, okay, we can affect the amount of heart attack and strokes we have in this community. All right, now this is the easy one, the what to do. Obviously, stop smoking. The other thing is with the blood pressure, so many people come into my office and sometimes just complaining of back pain, and they've got a blood pressure of 210/170, right, ladies? and the fact is, they don't have a blood pressure monitor at home. Or if they do, they say, oh, I've got one. Oh, yeah, okay, take the dust off. I know what that means, okay? If you've got high blood pressure and it is not controlled, going to your family doctor every 6 months or 1 year is not going to do it. You've got to either get a blood pressure cuff, and granted, the blood pressure cuffs on the wrists are not as good as here, but guess what? They're better than not doing it at all, okay? If you're diabetic, you check your sugars, hopefully, every day, okay? You should check your blood pressure. That is mandatory. And if it stays elevated, if you see that your blood pressure maintains a 160, 170, you need to call your family doctor. You need to say, this is what the numbers are. Here it is. I've been checking on it for a week or two. And what do we need to do about this? To move. That's a big thing. And so is improving the diet. I don't have a magic answer. 50% of the population are overweight. That's a big deal, okay? And if it was easy, 50% wouldn't be overweight. But I do have a little recommendation, okay? Being in medicine for 27 years, I think there's three aspects to this. The first is decide what your priorities are, okay? And that's not, well, I want to fit into a smaller pair of jeans. That's fair, but it's not great, okay? How about something really important like you want to get to your grandkids' high school graduation, okay? That's a reason, okay? And that's what's important. The second thing is accountability, but accountability to self. So it's something easy. I'm a big whiteboard person, but put a whiteboard, put a piece of paper on the refrigerator. Put Monday through Sunday, okay? Check off every time you go for a walk. Or if you're cutting down on smoking, yesterday I smoked 20, but today I only smoked 19. That's something positive. You don't have to do it overnight. You won't be able to sustain it overnight. A little bit at a time. The final thing, recommendation, is partnership. Whether it is your mate, whether it is your friend, whether it is your next door neighbor that you're not even crazy about, the fact is it doesn't matter. If you can go for a walk with them, if you can whatever, okay? Again, it goes more back to accountability. Geez, I told him I was going to walk at 7 o'clock. I guess I'm going to have to, okay? That adds to it. All right, the treatment. The first thing after you believe, okay? You're not doctors, you're not going to know, okay? That's okay. But if you strongly suspect a stroke, okay, do not drive to the hospital, okay? Do not wait for Charlie to come home in 3 hours, okay? Call 911 for a couple of reasons. Number one, you don't want to kill yourself or someone else if you're driving to the hospital and have that stuttering aspect of the stroke and it's more severe, okay? The other reason, which is very smart, is the EMTs, when they evaluate you almost immediately. They call into the hospital and say, possible or probable stroke. Guess what? We've got everything going, okay? We already know what to expect. So the next thing is not only EMT to examine, but the physician to examine. If there is a high likelihood of a stroke, we send the patient to a CT scan to decide whether the stroke is ischemic, which is lack of blood, or whether there's blood in the head, which is hemorrhagic, because we treat these two differently. In regards to that, there's basically a clot that has occurred in one of the vessels when it's ischemic. And what they do is give a special type of, it's called TPA, but there's a couple of different names. And what that does is dissolve the clot. And in fact, I heard that we're hearing about one such case later on. But that's one of the first things. We've got to get that CT scan to determine what type of stroke it is. And the final one is after the acute phase. Okay, let's get over that first hour, okay, that first day even. And what we will be doing is getting physical therapy, occupational therapy, speech. We will start an antithrombolytic medication, usually aspirin, but it can be other things. A statin medication is because the vast majority of people that have strokes have very high cholesterol, so we put them on this medicine. We also will talk to them about decreasing the risk factors, whether it is blood pressure, those types of things, smoking. DVT, prophylaxis, that's important. That is a blood clot that occurs when you're not moving, so especially with somebody that is paralyzed or weak on one side, that left leg does not move quite as well as the other one, and therefore is static and has a risk of having a clot there, which can then go to the heart or lungs. So we make sure that those legs are massaged and these types of things. And if the patient has a certain type of heart problems, which we'll talk about in a little bit, they may need to be on an anticoagulant like Coumadin or other types. And then finally, what we're doing today is education. I just wanted to say thank you for coming. I think our questions are going to be after we talk. What else do I have? The main community goal is to decrease the number of strokes and heart attacks in our community and improve the outcome of patients with strokes and heart attacks. I thank you for your attention. You're on.
All right, everybody can hear me? Okay, well, thank you for having me. I just want to say that I am not an expert in stroke, but I did feel that I could bring some valuable information so that we don't get there. Let's see. There we go. So kind of like Dr. Samuel started out, I have some controllable risk factors and uncontrollable. Like she said, your age, your sex, your race, your family history, there's not much you can do about that. But there are some things you can do about your blood pressure, your cholesterol, atrial fibrillation, carotid stenosis, and you're probably thinking, well, if I could do that, I wouldn't choose to have atrial fibrillation. Nobody would, pick that out of the lineup. But there are some things that we could do to lessen your chances of having it. Or even when we're diagnosed with some of these things, there's things that we can do that will decrease your chances of having a worse outcome. So what is atrial fibrillation? Atrial fibrillation is a quivering or irregular heartbeat known as an arrhythmia. The top one is your, I guess I'm over here. The top one is your normal heartbeat. So the little bump first is the top part of your heart. The big spike is the bottom. And then you kind of have the relaxation period. And it's very regular. If you were going to clap, you could guess when the next one is coming. You can feel it when you take your blood pressure. It'll have your pulse. It's very regular for you. In AFib, you kind of lose that. You're getting signals coming from all parts of the heart that are going through, telling it when to beat, and you kind of lose that rhythm going on. So if you're checking your pulse, you can't guess when the next one's going to come. So atrial fibrillation is the most common type of arrhythmia, and people live with it all the time. But your incidence of having it is about 25% for those who are over 40. And all of us think we're going to be these three people holding hands over here. Nobody's going to be that one person that gets it by themselves, but somebody's going to be that person. All right, so there are things that are associated with AFib that will kind of increase your chances of having it. Hypertensive heart disease, coronary artery disease, valvular heart disease, congestive heart failure. So again, I mentioned these to you because these are very common things that a lot of people have. So if you have these things, then you just want to be aware, do I have any of the symptoms that I'm about to talk about? Are these things that I need to tell my doctor about so that we can kind of look a little bit further? So I know you're thinking, that was all good. I have some information, but I want to know what can I do so that I don't have it, so I'm not that one person by myself. So the symptoms of AFib are your heart racing, your heart skipping. I ask patients, do they feel like your heart's going to run away from you? Is it flip-flopping around? You can get some chest tightness, lightheaded, dizzy. It can be any time, but especially if you go to exert yourself, because your heart rate should get up normally when you go to do something. And so you can have AFib and it be a regular rate. Everybody thinks that AFib has to be really, really fast, and that's not true. But when you start to get up and do something, it will speed up, and sometimes the symptoms are more prominent. They present themselves a little bit better. And then shortness of breath. Again, kind of the same thing. As we get up and do something, it will speed up, and then you get a little short of breath. I could do this yesterday or 2 weeks ago, and all of a sudden I can't walk to the mailbox, walk with my friend when I'm trying to lose weight and lessen my chances of hypertension. Okay. So what could happen? Well, one, I want to say one thing. This is just kind of my soapbox. So a lot of patients will come in and say, well, I went for my physical 2 weeks ago, and my doctor did an EKG, and they checked my blood pressure, and it was fine, so I didn't say anything. We can't treat you unless we know what you have. And the only thing we're getting at that time is what is happening right there in front of us. And they'll say, well, if something was really wrong, the doctor would have picked it up. It can be your most favoritist provider in the whole world. They cannot walk in that room and just go, I think you have AFib, without having something there. So you have to tell us if you have any of those symptoms a week ago, 2 weeks ago, or yesterday. Okay? So what could happen? So you can have a systemic embolism or stroke. That's the most frequent common complication of atrial fibrillation. Why? And so this makes sense in my head, and this is how, I hope it makes sense to everybody else, because this is how I describe it to patients. So to me, I think about if you're cooking. So you got a pot on the stove, and as long as you keep stirring, nothing sticks to the bottom. You don't get that nasty film on top of the soup or whatever you're cooking, but you walk away from it and you come back, and all of a sudden you got to scrape the bottom of the pot, and you move the spoon and that's sticking to it because it's set there beside each other. And anything that stands beside each other for a long time is going to kind of hang out together. And that's the same thing that happens in the heart. Just like we talked about the normal rhythm, top, bottom, and every time you have a pump, you get a good stir. So when you have AFib, you lose that good pump. Your heart's just fibrillating, fluttering there. And then every once in a while you get a good stir. But while it sits there, all that blood likes to sit beside each other, and then it can form that clot, and then we don't want it to come out and go anywhere in the body, especially to the brain. All right. So we have some treatments for AFib, and there are lots of different ones. And that's very individualized, so I didn't talk about it too much, but we can control your heart rate. We can try to get you out of atrial fibrillation, and you can do that with different things, medications, a cardioversion, where we kind of shock you back into that regular rhythm, or different procedures like ablations. But the common thing that we will talk about no matter what is anticoagulation. So Dr. Samuels already mentioned the anticoagulation is Coumadin or warfarin. We have some different ones now: Eliquis, Pradaxa, Xarelto, Savesa, some of the ones that you don't have to go and you go to the doctor all the time, you get your finger pricked, you check your INR. But again, this can be very individualized on who needs what, but it is something that you need to talk about. Now, we try to figure out who needs anticoagulation and who doesn't. And we do that by saying who's at a higher risk for having a stroke. If you have AFib at all, doesn't matter, you just stand there by yourself, and we don't talk about your age, your family, any other diseases that you have, your risk of stroke is higher than the average person. But some other things can increase that risk. And this is our list: congestive heart failure, hypertension, things you can't control, are you a woman, and then your birthdays. So some of those things you just automatically get points if you've had enough birthdays come along. If we start getting high enough numbers, and the number's not very high, it's only, really 1, but then definitely 2, then we really want to talk about anticoagulation. And this is where as soon as I say it in the room, everybody looks at me like, this lady's trying to kill me. You hear that commercial if you are a loved one, and it's the Xarelto commercial or Eliquis, and there is a risk. We are thinning your blood, and there's a risk for bleed, but they don't tell you in that commercial is your risk of stroke. And so that's why we're trying to come together with you and with the doctors. When we try to talk to your other doctors, do you have kidney disorder, liver trouble? It's going to be kind of a group discussion on whether this fits you or not. And so we like some charts and we like some points, so we kind of have some reasons on why we're going to do something. So we look at these things, and some of them, increase your risk for bleeding and increase your risk for stroke, like hypertension. But do you have kidney disease? Do you have liver disease? Have you ever had a bleed before? These are things we want. Do you fall a lot? The last thing I want to do is put you on a blood thinner to try to prevent you from having some issue, but you fall quite often, and you fall and hit your head, and we end up with a bigger problem than we're trying to prevent. Drugs and alcohol, things we always want you to be honest with your doctor, because these are things that we want to know. Even medications that other doctors prescribe you, we need to know what they are, so we make sure we give you the right medicine and the right dose. All right, and that's all I got for you.
So now we're going to take just a minute and kind of change things up a little bit. Very excited to introduce Howard Whitfield. He is Director of Rehab Services here at the hospital. While he's coming up, want to tell you that for questions, we want you guys to look in your bags that we gave you, and there is pad and pencil in there. And we would like for you to write some of your questions down that you have for any of our speakers on there, and we will come around. We have some folks in the back that will come around and collect them in just a minute, and then we will direct those questions to our speakers. So that's how we're going to handle that. So this time, here's Howard Whitfield.
Can everybody hear me? Okay. First of all, thank you guys for being here. It's certainly wonderful to see a room full of people who are interested in their health, and we appreciate you being here and joining us tonight. I do have tonight, I am not the guest speaker, which you should be thrilled about. I'm just up here to facilitate, because what we have tonight is Miss Linda Luck, who is actually a patient of ours. We unfortunately get the privilege of treating folks after they've unfortunately had a stroke. So we don't necessarily get them on the front end, we get them on the back end, which we're glad to do. We're here to serve you guys and the community, but usually when you get to us, it's not because you want to be there, it's because pretty much you have to be. So here we have services. We have physical therapy, occupational therapy, and speech therapy, and I do have a couple of my therapists here tonight. Mike, who's back, who was at the raffle table. We are raffling off a exercise ball to encourage some movement, like Dr. Samuels was talking about. So definitely raffle, sign up for that. And I do have Ashley Higginson, my lead speech language pathologist, who's here tonight with Miss Linda Luck, who was a stroke survivor. We also have her daughter, Anita Luck Poland, who I actually went to high school with. So I've known Anita for a long time. So they're going to come up and we're going to have a panel discussion for you guys. The best way to learn information, in my experience, is to tell a story. And she has, in my opinion, a pretty wonderful story to share with us tonight. And nobody better to tell it than Miss Linda herself. So you guys want to come on up? I do have some questions prepared for Miss Linda, but certainly if anybody has anything specific they want to ask Miss Linda, feel free to raise your hand, stop me, and she'll be glad to try to answer that for you. And then if she's not able, maybe Ashley or Anita will be glad to do that for you. So, Miss Linda, I'm going to get right into kind of your situation. As you can tell, looking at Miss Linda, does she look like she's had a stroke? She looks completely normal, doesn't she? Absolutely. But Miss Linda, tell us how you figured out you felt like something was wrong. And there should be a microphone right there for you so that everybody can hear you.
Pick us on? I don't know. I was at work. It was a Friday morning, though? No.
It's working for the camera.
It's working for the camera. Okay.
Just keep it close. There you go.
I was at work. It was a Friday morning. Everything started just normal. And then John Best asked me a question. And for some reason, he didn't understand what I was saying. But for some reason, I didn't know that it was different. But John Best recognized the speech was different.
How was your speech different in the fact that you couldn't get speech out?
No, I was talking it, and I thought I was sounding normal, but he sounded like I was speaking in French.
He said it wasn't garbled, it was like fluent French.
Fluent French. Mm-hmm. Okay.
And I had no weakness, no numbness, but I'm so thankful they called the rescue squad.
And Ashley may be able to speak to this, but that's called aphasia. Has anybody ever heard that term, aphasia? There's a couple different types of aphasia. One is where you can't get out what you're trying to say. And there's another type called receptive where people are talking to you and you're having a hard time making sense of what they're saying. Okay. So wives, don't always get mad at your husbands if they're not listening to you. Maybe it's just, unfortunately, they may be going through something at the time, and there may be a situation there. So she couldn't get her words out, and then John Best, you said, I guess it's a co-worker of yours, and so did he recommend you?
The office just called the rescue squad, and then I came to Wayne Memorial, and then from that, everybody just took over.
Okay, so you came in on the ambulance?
Yes.
On 911, and then, like Dr. Samuels and Ms. Barnes was talking about a while ago, you called 911, so were we ready for you when you got here? Hopefully, we had already made some preparations for you when you got here. So did you go straight back, or how did that go once you got here?
Do you remember? I think I probably went to the emergency room.
Okay.
I think it's kind of a blur to her because I will say that it was like a well-oiled machine here. As a daughter, I could not have been more pleased with how quickly they acted. You could tell that they had a plan in place, and they knew exactly what they were supposed to do, and that time was of the essence, and they were determined to make the best decisions on her behalf.
Okay, good. So the T in FAST for time, okay, you cannot stress that enough. Can't stress that enough. If you ask Mike or Ashley or any of us in rehab, when we're working with people following a stroke, we hear it all the time. You know, I thought I just had a headache, so I went to bed to sleep it off. Or I had some numbness in my arm, but it went away, so I didn't think there was anything wrong. Those are things that you cannot ignore, like they were alluding to. You just cannot ignore those. Not trying to make everybody paranoid, a room full of, I don't want us to be paranoid about it, but certainly if you do detect a change, do not wait around. Get out here so we can get you taken care of. Okay, so she's back there probably having a CT scan?
Yes, correct.
Okay, and tell us a little bit about what you were thinking, feeling during that time as far as some emotions you might have been going through.
Deer in the headlight. Because my mom was just very active, working probably at least 40 hours a week. And then all of a sudden, when you ask her birthday, she can't tell you. So it's, you feel very helpless, but at the same time, very thankful that you've got people in place that know what to do. My mom, unlike some people, had no symptoms. She had what's called a cryptogenic stroke, which means that they can't find the source. It wasn't because of hypertension or diabetes or cholesterol or anything. But what I will say is Dr. Steve Moy, I believe, was the attending doctor, and he had recently went to a conference where they had spoken about a thrombectomy, which I'd never heard of the word, but he immediately went and called Vida and said, I have a patient here and this is what we're seeing. And when he came back, he said, this is what we're doing, we're airlifting your mom. I was so thankful he was educated because of that education that he had received just a couple of weeks earlier. In 2015, they had only done 5 thrombectomies at Vidant. Last year they did, I believe it was 40, and this year they're hoping for, maybe twice even that much. But that is the reason my mom is doing so well, because they administered the TPA and did the thrombectomy and worked together. The 2 hospitals were working together.
So like Dr. Samuels was talking about a while ago, TPA actually is a medication that can break up the clot. What a thrombectomy is, a thrombus, is basically the ball, if you will, the clot that's in the vessel that's keeping the blood flow from getting to the brain. And then the ectomy is they went in and basically took the blood clot out, which allowed the blood flow to start again and minimize damage to the brain. So basically came in and they decided to airlift you to Vidant.
Yes.
Okay, and so talk about that. Once you got to Vidant, and Anita, you may have to help her here. Once you got to Vidant, tell us how that process went when you got over there.
I think I went to the emergency room, and then it wasn't long before then they went to the operating room, or what area is called. So,
and of course, in the process, she can't speak for herself. She can't. She was not aware that she was having a stroke. She believed everyone, but her brain was not telling her something's not right. And so you couldn't count on her to say, yes, I want this surgery, I don't. And the surgeon from Greenville got in touch with me by phone and said, may we have verbal consent that it's okay to do the thrombectomy. And so when I got there, they already had her back. They were not wasting any time. And when I got to see her, she was in ICU, and she was talking and doing amazing. They were just very excited because on the way, of course, you're making a huge decision for someone else. They have to tell you the risks that are involved as well. And he said, your mom will not die from this, but she'll go home and probably be like a child for the rest of her life. And I knew that wasn't an option. And so I just said, if it was your mom, he said, oh, I'd do it. So that was just the go for me.
So you relied on the guidance from the physicians and support staff as far as helping you make the decision. Okay. So Ms. Luck, what's one thing you want to tell everybody out in the audience tonight? One thing that you'd say that you want to make sure they take away from here? What's one thing you could tell them from your experience?
Things have changed, but things are still good. There's always people to support me and help me. Ashley was always for me at Wayne Memorial. Just after I was discharged, they already had the speech therapy. Sometimes we saw like twice a week.
Twice a week. Mm-hmm.
And she just kept saying, it's going to get better, it's going to get better. At first it was like short phrases. Didn't do a lot of sentences to them. No. So, yeah, but I'm so glad that not to be so afraid. People are always here for help.
Okay, so it's hard for you guys to imagine, but like we see stroke patients all the time, and just the fact that she got here so quickly and was able to get the type of treatment that she was able to get has allowed her to I mean, essentially, this is what you got, okay, versus somebody who's really unable to communicate, potentially unable to walk, potentially unable to use one side of her body, so many things that could have happened that didn't, because she was diligent about doing that. So, congratulations. Congratulations. So, does anybody have any specific questions they'd like to ask? Yes, ma'am.
What was the time span between the emergency call and the final surgery? How much time had passed?
The onset of the stroke symptoms was around 9 a.m. in the morning, and I wish I had a specific, but it was just a little bit after 11 when they actually started doing the thrombectomy. So it was a quick process.
And kind of that ideal window is, and correct me if I'm wrong, is around 3 hours. Is that right? Yeah. Yes, ma'am.
Stroke patients comes in, what determines who receives the CPA and who doesn't?
Great question.
Does all stroke patients receive CPA or just certain patients?
That's part of why we have to get the CT scan, because if you're having a hemorrhagic stroke, the worst thing that you could do is give a blood thinner, because it will make that hemorrhagic stroke larger. That's why we've got to get the CT scan before we can get the treatment. But the good news is the vast majority, 80% of people have the ischemic part, and the ischemic patients are the ones that can get the TPA. The other thing is it's got to be within a window. They used to say 3 hours. They're now kind of widening it. The American Stroke is saying, well, within 4.5. But obviously, the faster we can get it started, the better the person will be.
Question. Any others? Okay. Yes, ma'am.
If you have like one TIA, like you were talking about, do you just hear so much about it just repeatedly happening then? And I don't know if it's just you get paranoid or you're worried about it or what it is, you know. And you just wonder, you know, what are your chances of just if you want to really have just another TIA or something that's really worse for you?
Well, if you have a TIA within the next 30 days, you have a 10% chance, okay? And it will either be another TIA or a stroke. So that's the whole idea. It is a warning sign to go to take it literally, to see the importance of it, and instead of being afraid, doing something about it.
Because I think so often that people hesitate to come to the hospital because they don't want you to think you're crazy, you know, foolish, crazy, or you know that.
We hear that. We actually hear that a lot. You know, after the fact, after we're treating them, her comment was that people think you're crazy for wanting to go somewhere to get things checked out, and you know, that's probably where we as medical professionals maybe could do a better job of listening. But having said that, when you experience something that you feel like is a change in your condition, kind of don't take no for an answer. Push that envelope if you need to, and get the help that you need, because it's you, it's your body, it's you know, it's your brain. So kind of push that envelope if you will, because we hear all the time, you know, I had symptoms and it went away. And you know, we hear that a lot too. Well, I can't afford you know, the ambulance ride, or I didn't want to go to the doctor. I didn't have the money to pay the doctor bill. Unfortunately, we hear that too. So that's something that, you know, is an issue politically, and I'm not here to get into that. But that's something that, you know, sometimes you just have to, you'll figure that out later.
The statistic in regards to disability is that if you've had a stroke, you've got a 70% chance of not going back to work. So if you're worried about money, worried about, well, gee, I can't take time off from work. Well, wait a minute. If you want to go back to work, if you want to be productive, then you check it out and call 911.
Good advice. Yes, sir.
On the two different types of strokes, is there any symptoms that are dissimilar?
The question is, from the two different types of strokes, ischemic and hemorrhagic, are there symptoms that are dissimilar? Dr.
No, they're the symptoms. Who asked the question? So I didn't. Okay. The symptoms depend upon what part of the brain. So if it is hemorrhagic or ischemic, if it's in the occipital lobe, as an example, you're going to have visual changes. The other thing to know is that as far as long-term is concerned, the chance of death, the chance of recurrence, all of those things are about the same also.
Yeah, one is sort of too much blood and the other's the lack of blood. It's kind of the distinction.
Linda, did you ever feel really frightened, or did you just really not have a clue?
I wasn't. Isn't that weird? But I wasn't frightened.
So the question for you guys in the back is that did she ever feel frightened as things were evolving and happening? And she said, no, not really.
Again, I think it was a gift because her brain wasn't telling her what was going on, so that was...
Maybe I was in a blur.
Yes,
It
ma'am.
would be really bad if you were by yourself.
She wouldn't have gotten help because she would have known to get help. That was a divine intervention, a gift that Mama had.
I just wanted to ask, from the time you started your therapy and stuff, how long did it take? You said breathing was difficult, how long did you do therapy before you are able to continue?
We worked diligently for 2 months. 2 months. Yeah. And then she said, keep working on your own.
Working on what? What did she have to work on?
Speech. There were some computer games that she recommended. And I think who was it who told us in Vida? He said, just keep talking, because there's a tendency to be reserved, and it may not sound right, so you just don't say anything, but you just have to keep talking.
Mm-hmm. So did you lose your speech totally?
No, I always had my speech.
I will tell you, though, that a lot of times family members are guilty of finishing sentences for people who are having a difficult time, and Ashley probably battles that more than the rest of us. But guard against that. If you know somebody that's had a stroke, or if you have a family member that's had a stroke, let them talk. They need that. That's the best thing you can do for them, is be patient with them and let them try to get it out. Don't finish their sentences for them.
And I had the privilege of being in every session with the two of them, and I learned so much from Ashley. She challenged my mom, but she always encouraged her. So she balanced the challenging and the encouraging together. And I learned from there, you don't need to, like, if something comes out wrong, you don't have to make that an issue every single time. I mean, every once in a while, she eventually started hearing it herself, but it took her a while to hear that she was not saying what she thought she was saying. But the good thing is family members, and I would say when your family member has a stroke, I think the biggest thing is to just give hope and encouragement and have patience. And what I have learned that everybody told us at the beginning that you don't feel is true right then at the moment is that it just continues to get better. And 6 months after you see improvement, and a year after you see an improvement, and we expect the here and now. But the healthcare providers were always very encouraging, saying, don't give up, it's going to get better.